Hi everyone, this is Dr. Kingston, and in this video I'll be talking about the contents and relationships of the sublingual space. And our objective here is to identify exactly what those are. The sublingual space sits inferior to the tongue and deep to the mucosa of the oral floor. It's part of the oral cavity, so it shares that inferior border with the mylohyoid muscle that you see here and here. Laterally, it's surrounded by the mandibular body, and medially, it is bounded by the genioglossus muscle, which you can see right there. We haven't encountered genioglossus yet, but you can see it up here in this image on the right. There are two of them, even though they look like there's just one. There's one right and one left. And these are going to extend from the genial spines on the mandible, which sit right there. And they extend up into the body of the tongue and function to protrude it anteriorly or stick it out. Because of its central location here, it divides up the right sublingual space from the left sublingual space. The sublingual space is a fascial space, and just like the other fascial spaces that we've covered in this course, they're going to communicate with surrounding fascial spaces. So you learned this pathway up here from the infraorbital down to the submasseteric space into the pterygomandibular lateral pharyngeo retropharyngeal quite a while ago now. So now we're going to add to it. The sublingual space communicates directly with the submandibular space and the lateral pharyngeal spaces around the posterior border of the mylohyoid. So that mylohyoid muscle doesn't entirely close off the oral cavity from the neck. And we see a number of structures like the lingual artery and the hypoglossal nerve pass deep to the mylohyoid to get from the neck into the oral cavity. Well, where you have structures passing through, you also have fascia that surrounds them. So that's what creates this communication. Again, these communications provide a pathway for the spread of infection and metastasis, and the lateral pharyngeal space provides a direct pathway into the retropharyngeal or the danger space that leads into the thorax. So you'll need to be very cognizant of infections that might occur here, and that's going to include infections of the mandibular teeth. In addition to having a direct route to the thorax, infections in the sublingual space can be life-threatening without ever even spreading. So infection can cause what's referred to as Ludwig's angina, which is cellulitis or edema, fluid retention and swelling, in the sublingual or submandibular spaces. So here you can see all of this dark fluid here causing this swelling. And this can cause the tissues of the pharynx to pinch together and close off. So in this picture you can see that all of the swelling is literally pushing this poor individual's tongue up and back and closing off the space here in the oropharynx. This is an emergency and it needs immediate treatment. So luckily this person in the x-ray here did not end up having full closure of the pharynx. And according to Radiopedia, he was able to get treatment before breathing issues became really severe. For being such a small fascial space, the sublingual space is actually home to a surprisingly large number of structures. These are going to fall into two categories. We have things that are supplying the tongue neurovasculature for the tongue. This is going to include the lingual nerve, the lingual vein, the lingual artery, and the hypoglossal nerve. And then we also have some salivary glands and ducts from salivary glands traveling through here. So we mentioned the submandibular gland before, sits mostly in that submandibular triangle. Its duct is going to be running through this space. And sitting just inferior to it here is the sublingual gland, which sits entirely within the sublingual space. That sublingual gland is actually the largest gland to exist entirely within the sublingual space. Kind of unsurprisingly then, it's also the smallest of the three big salivary glands because it has to fit in such a narrow space. You can find its location in the oral cavity by identifying the sublingual fold of mucosa that covers its surface, as you see right there. The actual gland sits deep to that mucosa and sends up many small little ducts here that are going to open directly onto the oral floor. The duct of the submandibular gland, which sits, for the most part, down here in the submandibular triangle, also travels through the sublingual space. So the deep portion of the submandibular gland is going to sneak up over the edge of the mylohyoid muscle, and it will send its duct anteriorly, where it's going to exit through these sublingual caruncles. Unlike the sublingual glands, the submandibular glands only have the one duct, so all of its products will enter the oral cavity right here. These two salivary glands are close enough neighbors that they share an innervation pathway. Salivary glands get parasympathetic innervation to make them secrete, and in this case, that parasympathetic pathway originates up with the facial nerve. However, instead of traveling with the facial nerve out through the stylomastoid foramen and onto the face, those fibers are going to branch off in the middle ear and join the chorda tympani, which is going to travel out into the infratemporal fossa, where it joins up with the lingual nerve. The lingual nerve is a branch of V3, the mandibular nerve, that is going to travel into the oral cavity. It's carrying some somatic sensory fibers for the tongue and for the mucosa of the inferior oral cavity. Those parasympathetic fibers will ride along with the lingual nerve into the sublingual space, where they're going to synapse in the submandibular ganglion before making a short jump to their target gland. Now, the lingual nerve has a very distinct relationship with the submandibular duct. This will allow you to identify them, and more importantly, it'll help you tell them apart. So the lingual nerve, we can see here in the BlueLink image, travels into the oral cavity. It is going to travel anteriorly and inferiorly, and it is going to loop down underneath that submandibular duct. Then it's going to come up the other side of it to approach the tongue from underneath here, sending its fibers now anterior and superior. The end result here is that it ends up cradling the submandibular duct, just like you might cradle a baby. So you can see this relationship right here in the image on the right. It comes inferior to the duct again, and then back superior to get to the tongue. That was a pretty good transition into the neurovascular structures that we're going to see in the sublingual space. So in addition to the lingual nerve, we're going to find one other large nerve here, and that is the hypoglossal. You can see him right here. The hypoglossal nerve is carrying somatic motor innervation to the intrinsic and extrinsic tongue muscles. And in order to reach them, it's also going to pass deep to mylohyoid to enter into the sublingual space. And then, just like we saw with that lingual nerve, it's going to approach these muscles from an inferior position. A branch of the lingual drainage system is also going to be traveling along with it. So it has no matching artery here, therefore we call it the vena comitans of the hypoglossal nerve. Arteries found in the sublingual space are going to be branches of the lingual artery. So as it enters the sublingual space, just like everything else here, by passing deep to mylohyoid, it's going to give off the dorsal lingual artery, which will head superiorly to supply the posterior tongue, the palatine tonsil, and part of the soft palate. The bulk of the lingual artery then is going to pass deep to the hyoglossus muscle. And as it approaches this anterior part of the sublingual space, it's going to split into two branches. The deep lingual artery, which is kind of confusing because it's the more superior of the two, is going to pass more superiorly along the deep surface of the tongue. And the sublingual artery will stay deeper within the sublingual space and supply the sublingual gland and other tissues that make up the oral floor. The lingual vein is ultimately responsible for draining the submandibular space, and the tributary pattern that forms it follows pretty close to the branches of the lingual artery, but it isn't an exact match. So anteriorly, we have deep lingual and sublingual veins running along with their partner arteries, but you'll notice posteriorly here that these drain back to the vena comitans for the hypoglossal nerve, which eventually joins a few other branches back here to form the lingual vein. It's good to remember here that veins tend to be quite variable, and there's often a network of them rather than one big vein. The hyoglossus muscle, which is another extrinsic tongue muscle like the geniohyoid, provides somewhat of an obstacle for nerves and vessels entering the sublingual space. Most of these, as you can see by all of the blue structures on here, are going to travel lateral to the muscle to get where they're going. The major exception is the lingual artery, which is labeled in green to show that it is different. This decides to take a deeper route and pass medial to hyoglossus. This gives it an extra layer of protection, which is a good thing for an artery. The hyoglossus muscle also separates the sublingual space into a posterior and anterior compartment, with the hyoglossus muscle sitting entirely within that posterior space. Anteriorly, we have a pretty clear view of the genioglossus muscle here, and that is what, remember, divides the sublingual space into right and left. We can see the neurovasculature in this area sorting itself out by where it's going to go. So for instance, we can see that relationship of the lingual nerve and the submandibular duct. We can see the deep lingual vessels running together up along the deep surface of the tongue, and we can see the sublingual vessels and hypoglossal nerve heading into the deep sublingual space. One thing that I want to add here too, if you look at these lingual vessels, the way that they're drawn, the way that they're shown in most anatomical images, they look like they're pretty big and they kind of just come to an abrupt end here. And that's not entirely the case. They obviously don't extend any further, but instead of just ending, they have really extensive anastomoses with their partner from the right or the left. So they're not ending so much as they are forming a loop. All right, that is the end of the material for this video. Here is your review question. The indicated structure here enters the sublingual space by traveling B, medial to the hyoglossus muscle. We can see in the image here is that hyoglossus muscle, and we can clearly see this structure coming out from its medial side. This is our lingual artery, and it is, remember, the only structure that is going to course deep to that hyoglossus muscle within the sublingual space. That brings us to the end. Thank you for watching.